Good afternoon, and welcome to Cook County Health's Facebook Live on Healthy Hearts. February is Heart Month, which is a great time to discuss heart disease, the leading cause of death in the U.S. Here at Cook County Health, we are proud to have been recognized by U.S. News and World Report as a high-performing organization in the care of heart failure and heart attack, as well as the American Heart Association's 2023 Get With the Guidelines Heart Failure Gold Plus Award winner. I am honored to be joined here by a few members of our cardiology team who are here to discuss a few aspects of cardiac care, and I'll let them introduce themselves in a moment. I'm Kate Hedlund. I'm the Senior Communications Manager here at Cook County Health. But first, this is a live discussion. If you have questions about heart health, feel free to type them below. And if you're watching this after the session has ended, we're having another event next Tuesday, February 27th at noon, and we can try to answer your questions then. Now to our experts. If everyone can introduce themselves and talk about your area of expertise. Dr. Gomez, let's start with you.
Okay, thank you, Kate, for the opportunity to join here today. It's a great pleasure to be here. As you pointed out, I'm Dr. Javier Gomez, one of the cardiologists here in the Division of Cardiology of the Cook County Health System. I was trained here at Cook County in internal medicine and cardiology and stayed as a faculty member. My areas of interest are advanced cardiac imaging, with a particular emphasis on structural cardiac imaging. That's how I had the opportunity and pleasure of working directly with Dr. Saini in the structural cases. And the other area of expertise that I'm passionate about is cardio-oncology. So both of those are heavily related with advanced cardiac imaging, and that's my passion and my interest when it comes to cardiology.
Great. Dr. Malhotra, let's go to you.
Hi, everyone. Good afternoon. My name is Dr. Saurabh Malhotra. I'm the Director of Advanced Cardiac Imaging at Cook County Health, where I also direct the cardiac stress labs and the cardiac amyloidosis program, which again heavily relies on advanced imaging techniques, which we are happy to provide at Cook County Health.
And Dr. Saini, last but not least.
Thank you, Kate. Good afternoon, everyone. My name is Dr. Abhimanyu Saini. I'm an interventional or a procedural cardiologist by training. I'm also the director of the structural heart disease program at Cook County Health. I mostly do procedures as part of my day-to-day work at County. That's what I'm passionate about. Most of my procedures involve putting in new valves, preventing stroke by putting in plugs in the heart, as well as coronary stents in treatment for heart attack patients. I welcome this opportunity to talk in front of everyone so that we can put our message across to all the viewers that we would have today.
Great, thank you. This is another group question for everybody. Why cardiology? What interested you in the field? And I'll let anyone who wants to start take us off.
Okay, I'll start just because I started the previous one, but I think that's easy. I mean, for me, as I did internal medicine, it was very clear that my passion was with cardiology. Cardiovascular disease is the leading cause of death in the United States. That means that there's a lot of work to be done, and the pathophysiology of cardiovascular disease, as we got more into it during training, was more and more complex and exciting. So being able to understand, treat patients with cardiovascular disease, make an impact in their lives, and also tackle the leading cause of morbidity and mortality in the United States was very exciting, and that led me to pursue a career in cardiology. Further, particularly at Cook County, because the opportunity to provide that kind of care to the population we serve was particularly exciting for me. Kind of provide advanced cardiovascular care for a population that's often advanced in their stages of disease when we see them due to, challenges with access to healthcare and medications and things like that. Makes it, more challenging, but at the same time more rewarding when you see results. So that is what led me to follow this path.
I guess I'll go next to be in order. So, part of my training prior to my medical training was in epidemiology and prevention. I have a master's in public health from Johns Hopkins, and cardiology is a great field to apply those aspects of preventive medicine to halt disease progression, which, coupled with my interest in expertise in imaging, allows me to, peer inside the heart with advanced imaging techniques to identify diseases in the early stages, and then apply preventive and treatment aspects much earlier, which have been known to show better outcomes and provide greater longevity to our patients. I'm happy to say that we have the ability to provide for all advanced imaging techniques at Cook County Health, which has been a great success over the past few years with the help of leaders in the health system and my colleagues in the division.
Dr. Saini?
You're muted, Abby.
I would add to this that both of my colleagues here are very heavy on prevention and preventing diseases before they occur. I'm very heavy on the procedural aspects of it. Once patients have a cardiac problem, which is where my expertise comes in, is to intervene on to see if we can modify their disease process with some of the techniques that we have. I think my interest in cardiology mostly lies in that amongst everything else in medicine, which has a lot of gray areas, I find cardiology to be very quantifiable. This is something that I can explain myself in terms of numbers, in terms of the disease process. You can put a number to it and say that this is how bad your disease is. So when you can do that, I feel I can explain that to my patients very well. And that's where I think my interest lies in cardiology. As part of everyone here on the panel, I think one of our main goal is to put out things which are gray away and make it as black and white possible for the patients to understand well. So that's my main reason for cardiology as a chosen field amongst medicine. I'd like to expand on this, that at County, since the last 5 years, we've made several advancements, not just in imaging, which has been a major support to us, particularly support to me to doing these procedures. But we've also introduced lots of cutting edge procedures that were not present before and our patients didn't have access to. So I think now I'm proud to say that County is at par with providing access to our patients to any valve procedures, either for replacing a valve or modifying a valve, or to prevent strokes by putting in plugs in the heart. I think we provide it all, and there's a good synergy between the imaging aspects of cardiology and the procedural aspects of cardiology, which I hope we'll be able to put forth to the patients to understand today.
This is directed to really anyone who can answer this, but particularly to the doctors who talked about prevention. We discussed that heart disease is the leading cause of death in the U.S. What are some major factors that contribute to heart disease?
Dr. Malhotra, do you want to tackle this one?
Right. So, in broad strokes, of course, environmental factors, lifestyle, which include dietary habits, ability to exercise, and how active folks are. Cigarette smoking is a big risk factor, which we, of course, pay a lot of attention to in terms of educating our patients when we see them. In addition to that would be high cholesterol levels, which are linked to diet and ability to exercise, but also very importantly to genetics or abnormalities in our DNA that we are born with. And some people have a higher propensity of developing high cholesterol levels because they are predisposed to developing so from birth. So those are, although not modifiable, but definitely detectable and manageable and treatable to reverse the disease process, which we also have the ability to do in our division.
Great. Dr. Saini, can you talk about the interventions that people can reach within Cook County Health?
Absolutely. I think I'd like to divide the procedures, basically at least the ones that we are talking about today, into maybe three basic categories. One is patients who have heart attacks. They come in with heart attacks, and one of the most common procedures that we hear about is coronary angiogram, which is essentially a procedure where it's a minimally invasive procedure. We thread on our equipment through an IV line or an arterial line, either through our wrist or our leg, and we get access to the heart to open up that blockage and put in stents. That's one main category of procedures that we provide at Cook County, and we are available 24 hours, 365 days a year, and we have a dedicated team to take care of heart attack patients. There's a call team that we have to all respond to within 30 minutes of the patient arriving to Cook County at any of our locations, be it Provident or be it at our main campus at Stroger. So that's one main category of procedure, which takes up a large time and effort that we provide. The other main category of procedures I would like to point out is valve procedures. These are relatively newer techniques that have become more mainstream over the last 8 to 9 years now. And at Cook County, we've been providing this newer forms of procedures, mostly the TAVR, which is TAVR, for the last 4 years now. So these valve procedures, essentially what we do is, again, it's a minimally invasive procedure. It does not involve any major surgeries. It's done in the cath lab or a special place in the hospital where we do the angiograms. And it essentially also involves threading in our equipment through either an arterial line or a venous line in the leg or the arm. We get access to the heart. We put in a new valve in, and it's done on a beating heart while the patient is under anesthesia. And that's the second main class of procedures that we do. And I would say the third class of procedures that we would do, I can explain, is procedures for stroke prevention, or patients with congenital heart problems, something that they were born with, which could be an abnormal hole in the heart that needs to be closed, or it could be a patient who has an irregular heartbeat for which he needs to be on blood thinners. And for some reason, they cannot take blood thinners. So to prevent stroke, we put plugs inside the heart. So it's called the Watchman procedure, which is commonly the name that most people are aware or familiar with. So these are, I would say, the three basic categories of procedures I would say that we can offer at Cook County, in addition to others.
And I think you have a little show and tell for us with the valve.
Yes, I do. Actually, I have for our audience some of the things that we use here to do this procedure. This is actually a actual real life replica of a model. This is the same size of valve that we place during this procedure. And this valve is in the open form right now, but it comes crimped or collapsed, mounted on a balloon, so as to that we can put it or thread it through a small channel in the artery and go up to the heart and put the valve in. I'd like to say both Dr. Malhotra and Dr. Gomez can add to this. We do a lot of planning for these procedures with imaging, one of them being cardiac CT. And cardiac CT has given us the ability to look at the heart in such great detail that we can actually print models of the heart itself, a 3D model of the heart using 3D printers. And we've done that a couple of times in the past on patients who have very challenging procedures coming out if they have very challenging anatomy that we would think or we would anticipate some problems. So we can actually print out models in 3 dimension. This is part of the valve that we actually printed off a CT scan, and I'm showing it to you. I don't know how well you can see, but there's a valve inside. So this is actually a printed model of an actual CT, and that helps us also plan these procedures to very detailed accuracy before we do these procedures. So they are not blind procedures, and they are modeled on a lot of pre-planning and imaging that we do. So I think I'll take the discussion back to Dr. Gomez and Dr. Malhotra to add on to the imaging, because they are both the eyes that we need before these procedures are done.
Yes, can you guys both talk about the role that imaging plays in cardiac care?
Absolutely, absolutely. Let me jump in. Just to, to continue with what Dr. Saini is saying, the reason the structural program, I think one of the main reasons the structural program has had, a big success here at the county system and has been growing significantly for the last few years is because we've been able to work together. The imaging portion is it's fundamental to the structural success. So as I said before, my passion is structural imaging. So as the director of structural imaging here at the hospital, as Dr. Saini said, we do a lot of work. So the modalities that we rely on here are, as he said, cardiac CT, which is used heavily for pre-procedural planning in Watchman cases sometimes, always in TAVR cases, which are the replacement of the aortic valve through the leg without open heart surgery, and many other procedures. In addition to that, sometimes we have very advanced 3D techniques of transesophageal echocardiogram, which has been the cornerstone of these procedures. And, and we also have access to cardiac MRI if need be, and other modalities. So, the more frequent use and the access that we've achieved and the expertise that we've achieved in performing and interpreting these advanced imaging modalities has allowed us to provide Dr. Saini with the information he needs pre-procedurally, intra-procedurally. For most cases, one of us is there. For the majority of cases, I'm there during the procedure, but Dr. Malhotra has also been there. And some other attendings also are part of the core team, where we go in during the procedure and communicate directly with Dr. Saini as the valve is being deployed, as we are replacing the valve. That allows us in real time to make adjustments and fine-tuning in order to guarantee the success of the procedures. And then a huge role is follow-up and post-procedural imaging. So this requires a very close working communication between the different areas of expertise for this. So these are very complex procedures. We are basically replacing open heart surgery with these procedures for our patient population, which is something that has a huge impact in patient quality of life, in patients who, for example, are not surgical candidates. And based on this advances in technologies, we can provide them with that therapeutic alternatives, and then lead to patients feeling much better, improving outcomes, improving survival. So, through the leadership of Dr. Malhotra, as he said, he's the director of advanced imaging. I focus on one area in particular, but through all the work that we've been doing together, we've been able to advance the care that we provide at CCH significantly in the last few years, to the point where we now, as Dr. Malhotra and Dr. Saini said, provide all modalities of advanced cardiac imaging, and we perform, I believe, all types of structural interventions as well. So, this is and providing this to our patient population is challenging, as I said before. There's a lot of issues that need to be addressed, but we've been able to overcome them. And I think part of it is the core group that we have. Part of it is our leadership has been able to engage, all the right people and stakeholders. But the main driver is our desire to provide the best possible care to our patients. And we've been thankfully successful in achieving that.
Dr. Malhotra, I have to imagine that for our patients, the advancements that we're making in imaging and care are life-changing for a lot of them.
Absolutely, Kate. we are now looking at, as I mentioned, structure and function of their hearts with advanced techniques. We are going in for advanced procedures, knowing exactly the size of the device or the valve that Dr. Saini is going to implant. So there's no guesswork involved. Everything is pre-planned. The therapies are catered now towards the patient. So it's more patient-centered care starting from not only just seeing and evaluating the patients, but imaging the patients, reporting their results, and then planning the procedures and actually doing the procedures and then following up thereafter. So it's an entire process, and we have a gamut of expertise now that has advanced the care of our patients from prevention to imaging to therapies.
Dr. Malhotra, changing the topic a little bit, but when people think about heart disease, I think everybody kind of automatically thinks about heart attacks. One of your areas of expertise, I've been told, is in cardiac amyloidosis. Can you explain what that is and what are some of the signs and symptoms?
Yeah, so thank you for that question. So amyloidosis used to be thought of as a rare disease. It's not as rare as we used to think it is, and it's actually, I would probably say that's endemic in our population that we see at Cook County Health. One of the reasons to develop amyloidosis is genetic abnormalities or mutations, as we call them in the DNA, which predispose patients, and in the US, specifically African American patients, are particularly at risk of developing this due to a high prevalence of this mutation in that population. And we at Cook County are fortunate enough to take care of that population. And that's why I said it's not a rare disease anymore. It was less often diagnosed, but I have to give credit to my colleagues who are on this call as well, who are now partnering with diagnosis of this technique, which involves, of course, careful clinical history and examination, along with advanced imaging techniques that we have, like MRI and nuclear scans. And then also, some of these patients, along with having cardiac amyloidosis, also suffer from other problems which coexist in these patients, such as valvular heart disease, which Dr. Saini and Dr. Gomez are instrumental in helping with. But this is a prevalent disease in our population that we see at Cook County. We have diagnosed several hundred cases now. The important thing to remember is we have access to confirmatory diagnosis. We have access to advanced therapies for this problem. So we're not just seeing patients and diagnosing patients, we're actually actively managing this medical problem and stopping its progression to more serious problem in the future.
And I think a couple of you touched on this, but what is the role genetics plays in cardiac issues? We know that family history can play a part, but what are things that families should be discussing when it comes to heart health?
Yeah, I can take the first stab at that. So, we have known that genetics plays a very important role. It's only recently that we have been able to identify certain peculiar genes that are pathogenic or that really cause the disease in our patients. Amyloid being one of them, hypertrophic cardiomyopathy being the other, familial hypercholesterolemia being one. So genetics does play an important role, and understanding of how these hereditary diseases are transmitted in a population is very, very important. In addition, there are other genetic factors that are less well quantified, and that is what we refer to as, in a broad stroke, as family history. So knowledge of family medical history of at least first generation relatives, maybe one or two generations at least, is very, very useful to know, because even though there are certain aspects of the genetics that cannot be quantified, we call them polygenic risk factors. but at least knowledge of the family history can give us a good sense of whether a problem or a heart disease is something that runs in the family or not.
Great. Last question, I think, for everybody is what is something that you hope people kind of take away from this discussion, or what somebody should know about heart health?
Okay, I can start with that. I mean, I think one thing to take away from this is, and I think everybody always will want that summary at the end. Okay, what do I need to do? Okay, and what should I do in terms of heart health? I think the one thing a couple of things to take out of this discussion is number one, we as an institution have currently made great efforts to be, let's say, at the state of the art when it comes to the care we provide. So the first thing is, seeking medical health is very important. The first step is always trying to reach out and getting evaluated, having a primary care that can refer you in a timely fashion. The other thing, as Dr. Malhotra pointed out, is addressing those risk factors, right? We can do a lot of interventions, but the most important thing is that people can be educated early on and prevent a lot of these pathologies. So when I think about it, I say, to me, particularly in the US, the two most important things that we can do is, it seems like it's stuff that we always say, but it seems hard to get done, which is physical activity and dietary changes. If people, realize, this is my take. I mean, I'm sure my partners will have, different perspectives, but I'm passionate about this because if people understood the impact that physical activity and dietary changes has in the overall cardiovascular health in the future, this is better than almost any medicine. But it requires a continuous effort, right? It should be started early on because later on it's going to be harder. So those things are very important. Seeking care at the right time, and we're more than happy to provide with top of the line care, but people need to seek medical advice and try to address those risk factors. Smoking is terrible, for your heart health. Physical inactivity is a very big problem in the U.S. And the composition of the U.S. diet is also a big problem because it leads to this elevated cholesterol, and it leads to a lot of inflammation in the body that ends up leading to valvular heart disease, heart attacks, and things like that. So I would say, if you want to take a very small amount of take-home points from this, would be establish medical care for you and your family, and address those risk factors. Try to be active, eat healthy, and avoid smoking. I think with those, most people are going to be in a much better condition than without doing those. And whenever that is not enough, that's where we come in to get you that extra little intervention that's going to keep you healthy.
Absolutely. Dr. Malhotra, do you want to take the next? And any thoughts you have?
Right. So very eloquently put by Dr. Gomez, but I just want to say heart disease is preventable, and heart disease is effectively treatable as well. So of course, our focus should be on prevention and to limit the burden of the disease, but we have the ability to treat it, and I think we are getting better and better at it at County. I would like to emphasize that I would recommend people be aware of their family health history. That is one way of knowing if certain diseases segregate in families. That does not only just have health ramifications, but can also have socioeconomic ramifications as well. And our ability of our patients to work longer, have a productive lifestyle, may be linked to certain form of genetic diseases that they may not be aware of.
Dr. Saini, you want to wrap this up?
Yes, of course, everyone wants not to get sick. Everyone wants to prevent diseases, but unfortunately, we all at some point need some help. If whether be it medications, there are medications that your provider or your cardiologist can prescribe you. Talk to him, meet him, listen to him, discuss it with him. And then if medications don't work, and if you are at a point where there are procedures needed for the heart, unfortunately, no one likes those, but we have now available at Cook County almost every procedure, whether be it for the vessels of the heart, whether be it for the valves of the heart, and not just minimally invasive techniques. We do have a robust open heart surgery program as well, where we work very closely with our surgeons. So I think the leadership here at Cook County Health has put up a very comprehensive team, starting from prevention of cardiac disease to genetically looking for cardiac diseases to medications that we can provide, and then fortunately and unfortunately the interventions or the procedures that are needed, or if open heart surgery is needed. So we have a comprehensive team out there. Seek care. A lot of our patients are elderly. They might not have all the resources at their fingertips or at their disposal, but we are here. Talk to your primary care or talk to your cardiology team, and we can set up a plan for you.
Thank you. So I'd like to thank our physicians for taking time today to discuss heart health with us. And if you want to learn more about our cardiology team, visit our website at cookcountyhealth.org, or to make an appointment, call 312-864-0200. Thank you and happy Heart Month. Stay healthy.
Thank you.
Thank you.
Thank you.